Hello, my name is Andy Ambergy, and I am with Donate Life Indiana and Indiana Donor Network. I am the education specialist, former teacher background. I was a teacher for almost 10 years. And this is...
I'm Brianna Brown. I am a registered nurse. I graduated from the University of Evansville, go Aces. I also have my master's in business administration, and I'm a certified grief counselor.
So, thank you so much for joining us. Let's get started. Who is Donate Life Indiana and who is Indiana Donor Network? So here we go. Donate Life is the national brand for organ donation awareness. Donate Life America is located around Virginia, but there is a Donate Life in almost every state. We are community educators. We are trying to get more people to sign up to be organ donors. I work for Donate Life Indiana and Indiana Donor Network. But we also have our partners. So in Indiana, we work with Vision First, where we store our corneas. And then we also have our BMV relationship, because that's where you sign up to be a donor. And Indiana Donor Network is our organ procurement organization that I work out of. And lastly, we have our other partners, our transplant hospitals. The three places where if you needed a transplant in the state of Indiana, these are the hospitals that you would go to. So, what would it feel like to need a transplant? Well, I'm going to have you grab your straw, and with the straw, you are going to be putting this in your mouth, and you're going to be pinching your nose. We're going to see what it would feel like to need a single or double lung transplant. One more thing though, when you do that, I want you to run in place for 30 seconds like this. So go ahead, try that for 30 seconds. Once you're done with that, think about it. Imagine this young boy, somebody who's on the transplant waiting list. He's getting a nebulizer treatment. But what I want to say is we don't typically need a transplant if we have something just like asthma. Typically doctors can diagnose asthma and give the proper medication. But this young man might have cystic fibrosis and he might need oxygen treatments, and he could potentially need a transplant one day. Now, do you recognize this stadium? This is Lucas Oil Stadium, and of course I'm not here to talk about the Colts today. I want you now to imagine this as a large waiting room, because if I were to fill Lucas Oil Stadium 2 times full, that's over 110,000 people. That's the amount of people in the United States that need an organ transplant. Imagine that. Lucas Oil Stadium is huge. And now I have the real-time numbers. This is from February of 2020. You can see just what organ everybody is in need of. You can see in Indiana, 87 people need a heart transplant. 12 people need a lung transplant. But I want to go a little bit more in depth about this, because I want to certainly say when we think about the wait list, this is infants. This is young children, toddlers, adults, and elderly. All can be listed on the wait list, meaning the medications they are on are no longer working. Their organs are in failure. And we can't always determine when we're going to need a transplant. Is it because of a birth defect? Is it because of a genetic disease? We can't always determine that. And sadly, guys, today, an average of 22 people will die because they will not get the life-saving organ transplant that they need in time. 22 people. How devastating is that? That's going to be over 7,000 people this year will die. Over 7,000. What can we do about that, and why are so many people passing away?
This is where your job as a nurse really comes into effect. You can see here that we have just over 6 million Hoosiers in the state of Indiana. 4 million of those are registered. We are so proud of that number, and that is an incredible goal we have achieved. But let's see why those people are still dying every day. 65,000 deaths in the state of Indiana, 18,000 of those were in a hospital. Of those in the hospital, only 7,000 organ referrals were called to Indiana Donor Network. Of those 7,000, 272 people were actual eligible organ donors out of all these deaths in the state of Indiana. And out of those, 198 of them said yes or had made the decision to be an organ donor. Even if everyone who was eligible to be an organ donor successfully donated their organs on their death, that's still about 1% of people who die will die in a way that they can be an organ donor.
And so this begs back to the question, what are we doing about this, and how can we, help support this so that so many people are not continuing to die every day? Well, part of what Donate Life Indiana and Donate Lives across the country do is we talk about organ donation, and we talk about the importance of signing up to be a donor. We, as education specialists, want people in the community to be able to ask questions. Donate Life educates because did you know that just one person, that they could save up to 83 people's lives? That's one person. But how can one person that chooses to sign up to be an organ donor save 83 lives? I'm going to pause here. Anybody? Think about it. 83 lives because we can be an organ and a tissue donor. And remember, as she stated, we have a very small, minute number that can actually become organ donors, so tissue donation becomes even more powerful and important. You can save and heal so many lives. Check out this chart. We have 8 organs and then up to 75 lives through tissue. And I have a few tissue models that I do want to share. One of the tissues that we can donate is we can take our ligaments and our tendons, and often this is taken from the patellar tendon. We can take it from the Achilles. We can take it even from the anterior crucial ligaments. They help give us mobility. Well, if we are a tissue donor, we could give somebody their mobility back. Secondly, somebody who is having severe back pain, we can donate cartilage, but we can also donate bone grafts. And again, when we are an organ and tissue donor, we can still have an open casket funeral. But they can take bone grafts and insert them between the spine where somebody is having that nerve back pain, and they could heal that back pain. They can even use bone grafts for dental surgeries. They can use it for any kind of shoulder pain. And so I also want to mention another tissue we can donate and help save a life is skin grafts. We can donate skin grafts to help a veteran or a burn victim. And then lastly, another type of tissue, I have my eye model. And we can donate this thin transparent lens called a cornea. It has no color. It covers the iris. We can donate our cornea when somebody has an infection or gets a certain disease in their cornea. You could give somebody at the time of your death the gift of sight. And this is where these glasses come in. You can put these on if you created yours with your sunglasses at home, and you could see just what it would feel like if you needed that cornea transplant. And so I'm going to wrap up here. We've talked a lot about a donor and a donor hero. And this, I have to say, is, a devastating story, but one that ends in a little bit of, relief for the family that their son was able to be an organ donor and tissue donor. He is helping to save and heal lives even though he is no longer here. Here's their story.
The doctor came into the room and he told us that Noah was brain dead. And my first reaction after that was, no one's getting any part of Noah. No one will ever have any part of Noah. He's mine. After the doctor walked out of the room, I was holding on to Noah's foot. And I was just thinking, he's coming back, he's gonna be back. And then I looked over at my wife who was looking down, and I just thought more, this is real. This is real, he's not coming back. What happened was, in my mind, Noah sat up and he looked at me and he said, "Dad, what are you doing?" And I was like, what do you mean, what am I doing? And he said, don't let tragedy breed tragedy. There's another family in another hospital, or maybe the same hospital, sitting next to their child or family member, issuing a prayer, asking for help, asking for a miracle. And Noah, in his loss, tells me, Dad, make a miracle for somebody. And I looked at my wife and I said, honey. And she looked at me and she said, I know. And I was like, well, what do you mean you know? And she goes, you want him to be an organ donor? And I said, he wants to be an organ donor.
And so you take that sad, sad story, because anytime we think about death, it's tragic and it's tragedy. But you can see that the family found a little bit of a way to understand their grief better because he was able to save lives. And so I turn it over, and we're going to go a little bit more in depth into Indiana Donor Network and how Indiana Donor Network works with the donor family and after Noah left his legacy.
As Andy had mentioned earlier, Indiana Donor Network is the organ procurement organization for the state of Indiana. We are the vital link between those who are in need of a life-saving organ transplant and those who are dying and able to give that gift of life. We facilitate organ, tissue, and eye recovery in the state of Indiana, and we also work with our donor families. We are very proud of the work we do with our donor families and support them in their darkest hour. We're also innovative in creating new ways to make the best use of the gifts that our donors are able to give. And we have just this past May opened up the Indiana Donor Network Organ and Tissue Recovery Facility, which is very unique for an OPO to have. As a nurse, one thing that you're going to be given shortly upon your start in orientation is what we call our trigger card. Our trigger card basically tells you everything that we at Indiana Donor Network really need for you to know. The first part talks about what requires a call to Indiana Donor Network, that very first call, the referral to us. The second part talks about when you need to give us updates. So to make that initial phone call to us, we have a GCS of 5 or less, regardless of sedation. Poor prognosis, the beginning of end-of-life conversations. These are patients who are on a ventilator, families starting to talk about the quality of life for their loved one and having those initial conversations. That would trigger you to call us for that initial referral. Also, if family mentions donation, it doesn't necessarily have to be at end-of-life time conversations, but if family is having questions, let us know so that we can be there to appropriately answer those questions for them. And then when to give us a call back. If you've already made that initial referral to us, you're our eyes and ears on what's going on with that patient. You're the most intimately involved in the day-to-day operations of that care. So if they're starting to become unstable, if they're having a significant neurological decline, if they're talking about brain death testing, or again, end-of-life conversations, palliative care is getting involved, any of those situations, we would really need for you to give us a call back and let us know what's going on so that we can better support you, better support our teammates who are going to be coming in, as well as creating a plan for this family to give them the utmost care and support that they deserve. What happens when you make that referral call to us? So you're going to be calling our VitalLink Donation Center, and then on the back end, we're going to get some very basic information. What's this patient's demographic, their name, date of birth, things like that. Where are they located? What unit are they on? Are they stable? What brought them into the hospital? Are there end-of-life conversations? Those are the type of questions we're going to ask you. It shouldn't take too much of your time, but that's what we need to get our process started and to get somebody out to you or to touch base with you to get a little bit more information on what's going on with this patient. So after that initial screening, we review the medical condition of this patient and we determine an initial eligibility. Is there any potential for this patient to be an organ donor if end-of-life were to be the next steps? Once you have made that initial phone call to Indiana Donor Network, we will guide you and give you direction on what to do now. Every interaction with us is going to tell you when you need to give us a call back. It's going to reiterate those points on that trigger card, and it's going to tell you that we're here for you, and you can call our call center 24 hours a day, 7 days a week. There's always somebody available to answer your questions. If we can't physically be there in person, we're only a phone call away. It's important to know that just because you made a call or made that referral to Indiana Donor Network, your care for this patient does not change. It does not change their plan of care. It does not change the hope that you have for a significant recovery. A lot of our patients do fully recover, and we were just notified. There is no harm in calling us. All you're doing when you make that referral to us is telling us you have a patient in critical condition. Not always necessarily at end of life, but critical, and they could go either way. That call is just letting us be ready for if end of life are the next steps.
So, the heart on my driver's license means I will become an organ donor? The answer is absolutely no. Just because you have the heart on your driver's license does not mean that medical staff, medical personnel, EMT, paramedics will ever stop working to try to make that patient better. They will do anything and everything that they can, medication-wise and in the hospital, to support that family and try to get that patient well again. The heart on your driver's license is specifically for you. And that is to say you signed up to be an organ donor, and in the case that somebody dies, they are able to donate their organs and their tissue. So again, because you have the heart does not mean that medical care would ever stop because they want to utilize your organs or your tissue.
We talked about how hard it is, and even if you do have that heart on your driver's license and you are reaching your end of life time, how rare it is to even be an organ donor in the first place. There are several ways that somebody can donate their organs. The first and what people are most comfortable with is donation after brain death. So brain death is the total and irreversible destruction of the brain and the brain stem. It is not a coma. It cannot be only the upper part of the brain. It has to be both cortical and brain stem function, complete loss of both. These incidences listed here are typical injuries that we see that can result in brain death. It is by all means not all inclusive, but these are the most common injuries we see. And brain death is always declared per hospital policy. The second way for somebody to be an organ donor is by donation after circulatory death. This is donation after the heart and the respiratory functions have ceased. It's important to note that this was actually the original way that somebody became an organ donor. Brain death as defined as loss of brain and brain stem did not occur until the 1980s. So this was actually the original way that someone became an organ donor, but it's also the most complicated. So in these types of patients, they have a non-survivable injury. They are not going to recover, whether it's a neurological injury that they just won't progress to brain death, or maybe it's a severe respiratory injury that they're never going to become off the ventilator. The families have made the loving and incredibly difficult decision that their loved one would not want to live like that. They don't want to be ventilator dependent, and they have decided to pursue end-of-life care and terminally extubate the patient with the intention of their death following. That is important to know. Donation conversations for these patients will not occur until a family has made that decision. They are ready to stop aggressive treatment. The eligibility for this type of donation is a little bit more intense than with brain death donation, but it is something we will always walk you through each step of the way. It's also important to know the care for these patients stays as standard end-of-life comfort patients. The family can still be with their loved one, and the ventilator is removed and the heart is allowed to die naturally. How cool is it that organ donation is still able to follow even in a situation like this, saving more lives?
And so the third way that organ donation can happen is through living donation. Living donation is not something that you sign up on the registry for. Living donation is something that people do out of the kindness of their hearts. Often it is for another family member, but sometimes people do it for a complete stranger. This slide here shows Selena Gomez with her best friend. And just like we can donate blood and bone marrow while we're still alive, Selena's best friend donated one of her full kidneys, and she is doing extremely well, and Selena received the kidney because both of hers were in failure due to her disease, lupus. Now, not only can we donate one full kidney, we can also donate a partial lung lobe, and we can donate part of our liver, and guess what? It's like a lizard's tail. It will grow back.
The donation process can be kind of complicated and confusing to explain. I'm briefly going to talk to you about what the steps are in the donation process. It's important to know the very first step, diagnosis, comes from the hospital. It's that recognition that this patient is critical and most likely not going to survive. That's what triggers the donation process. Next comes the referral from you. That is your most important role in the donation process, is recognizing when to make that call to Indiana Donor Network. Again, that's the GCS of 5 or less, end-of-life conversations are beginning, or if family were to mention donation. After that referral comes and patient is nearing end of life, that triggers the family conversation. So our certified grief counselors or our family advocates will talk with the family about the option of donation or their loved one's decision to be an organ donor. And then the rest just kind of flows along this path through evaluating, matching, the recovery of the organs, and transplantation. There is a lot of time involved with the donation process. Our organ donors need to have a beating heart and remain on the ventilator until we can find the recipients. I mentioned in that previous slide that this can be a time-consuming process, and this is why. We have to navigate both the recipient's health and the donor's health in finding an OR time for both parties, making sure weather conditions are appropriate to facilitate the travel time involved. Typically, when a donor is going to the recovery room to donate their organs, their recipient is also in the operating room ready to receive that organ. Their surgeon is going to fly to wherever the donor is, do the recovery, and take it right back. That's the delicate time balance we have to navigate, and that can be very tricky to balance. And as Andy had mentioned before, one person can donate 8 organs. That could be 8 surgeons we're trying to collaborate with and find a good time to make this all happen. It's a very magical time and also very stressful, but that's what we're here to do. This is just some fun information that's kind of cool to know, how long each organ can be outside of the body and still be viable. You can see some of these organs have very small time frames, making that window that we have to find even more crucial. As I mentioned at the very beginning, our donor families are at the heart of everything we do. That is the core reason we are here. Donation does not happen without them. So we do everything we can to honor them and support them in the loving decisions and difficult decisions they've made. This is through an individualized bereavement program that we offer to all of our families, that they can choose exactly what they need and how we can help them. Through hospital honor walks, that's a way for our hospital partners to honor the gift that their loved one is giving. Through memory making, flag raises, recipient updates, this is all just a few of the many things we do to honor our families and our donors. We're going to take a second here to watch a very impactful video of a hospital honor walk. Now I'm going to take you through a scenario to apply the knowledge you have learned so far. So take a minute and review this report you're getting from the ED. So we're going to start off first with a question. How many lives could be saved and healed if a referral is made within the appropriate time frame to Indiana Donor Network? Got your answer? The answer is 83. 83 lives could be saved from one potential donor. Now we're going to take you through admission assessment followed by a night shift assessment. Just going to point out a few things. We got a really low blood pressure requiring a lot of support, a GCS of 4 initially. Night shift, still has a low blood pressure, not making much urine, still a GCS of 4. Take a second to read this over a little bit more in depth. Another question for you. Which nurse is responsible for notifying Indiana Donor Network? The answer is D. Each nurse has the same responsibility to call Indiana Donor Network because each assessment they did, the patient was meeting clinical triggers of a GCS of 5 or less. So this is night 1 going into day 2. Take a second to read what's happening here. Any ideas what's going on? These are classic symptoms of what we consider the herniation process. You guys may get a little bit more in-depth information about this as you go through your education, but just some brief information. Classic symptoms of the herniation process is hypertension, tachycardia, followed by an immediate drop in blood pressure. It's very important to know these symptoms are occurring so you can be prepared for that bottom out of the blood pressure. Not every patient is going to present the same way, but just know that you could lose a potential donor if you're not ready to treat this blood pressure when it drops. Take a second to look at what the MD decides to do once he recognizes the symptoms going on with this patient. In these situations, it can seem like the appropriate time to mention donation. I really want to encourage you not to have that conversation with the family. This is very early in the patient's hospitalization. The family is still very early in their grief. They're not quite ready to start talking about end of life yet. And if you were to mention donation, even with the best of intentions, it could really throw off the family and create a cascading effect. Research does show that the chances of donation, of family consenting to donation, significantly decreases if the ask is coming from someone outside of Indiana Donor Network. So please remember not to mention organ or tissue donation to a family. If you ever feel like you're in a situation where you need to say something, you can always say a family advocate will be in to talk to you about the next steps. So we've talked about the different steps that we've reached so far. The patients presented as if they were herniating. The MD met with the family to talk about goals of care. Now we're on to the next day. The patient is not looking too great. We still have a low blood pressure, not making much urine, looks to be an organ failure. We're waiting on a neuro consult. With all that has happened, when should have Indiana Donor Network been called? You guessed it, all of the above. Each of these warranted a phone call to Indiana Donor Network. They met the initial trigger when they were in the ED and had that initial assessment of a GCS of less than 5. And then each step throughout the way, that should have been an update phone call to us so we could have been prepared and helped you through the next steps. How does this scenario end? Family does decide they want to follow through with brain death testing. When we hear that that's the case, you should know that warrants a call to Indiana Donor Network. And in this scenario, it does. The nurse gives us a call and we have a coordinator available who can come on site and help you through the next steps. Anytime the brain death testing is being discussed, we encourage you and your physicians to look up the hospital policy and to review it. All hospital policies consist of the three things that are all the same. Prerequisites, things that have to be met before brain death testing can formally occur. This means correcting things that could mimic death. A clinical exam and an apnea test. There are some variations between what documentation is required and the use of ancillary studies, but those three things always must happen, starting with the prerequisites. So we will always encourage you to pull that policy to make sure that those things can be done before brain death testing occurs. The doctor takes the time to review this policy and starts working to correct those imbalances. With a patient that's in organ failure, a lot of things are going to be out of whack, so it does take some time to correct those. As the physician is doing the necessary treatments to correct those imbalances, family does start to come to grips with what has happened. They're starting the grieving process and recognizing their loved one would not want to be on the ventilator anymore. And in this scenario, they do decide to pursue comfort measures and end-of-life conversations are finalized. In this instance, our clinical coordinator who is on site will be able to give you that determination right then. Is this patient eligible for organ donation or not? In this instance, they are not. Why? What happened? How is this young 18-year-old who with no known medical history not able to be an organ donor upon his death? This was a huge tragedy that occurred, and it could have given such hope to this family and to the many others waiting on the transplant list. The answer is, we were notified too late. This patient went into organ failure. The blood pressure was not supported. Had we been called at the first initial GCS of less than 5, we could have been there to acknowledge what is happening and intervene sooner if need be. Not every situation falls in line like this. If a family does start to make end-of-life decisions, changing the code status and not wanting aggressive measures to treat a blood pressure, there's things we can do about it and to keep donation possible. That is why it is so important to call us at the first clinical triggers being met. We're going to end with one last question. What happens if a referral to Indiana Donor Network is completely missed or is late, not within a 1-hour time frame? All of the above. You could lose the opportunity to save 8 other people's lives through the loss of one of your patients. You're violating hospital policy. Your policy does lay out when and how you need to call Indiana Donor Network. It's also a violation of CMS requirements. We are required to be notified of impending death. So outside of the regulatory requirements involved with the policy and CMS requirements, there is that satisfaction of knowing you could help save 8 other people's lives too.
And so this here is a story, a real life situation where this young man needed a transplant. He was on the waiting list. He got to graduate high school and is now in college because somebody signed up to be an organ donor. A nurse helped call Indiana Donor Network and he received a transplant, because that is what this is all about. We take a tragedy and it is something sad and devastating, but on the other side there's a family that is waiting for that life-saving phone call. So David Peck lives his life now because of that organ transplant.
Some key takeaways from our presentation today is to call whenever a clinical trigger is met. The GCS of 5 or less at first mention of end-of-life conversations, or if family were to mention donation. And remember, brain death declaration is always per hospital policy. It is our responsibility to make sure that death is declared per hospital policy. Do not mention donation, whether this is for potential organ or tissue donation. Educate others, and then decide if you want to sign up to be a donor.
All right, so how do we sign up? Well, in Indiana and a lot of other states, we sign up at the BMV. Over 90% of people sign up when they go to get their driver's license or make a change on their license. Legally, the BMV is our partner, and they have to ask the question, do you want to be an organ donor? Signing up early could help make an easier decision on your family because they know that is something that you wanted to do. Now, what happens if I didn't sign up at the BMV? I can also sign up online at donatelifeindiana.org. I am very transparent in the fact that we can also remove our name at donatelifeindiana.org because it is you and your decision. It is your choice to sign up to be an organ donor. And then lastly, we can sign up from our iPhone health app. And so we can't thank you enough for joining us. Because we are not in person, we invite you to ask questions. You can submit those at donatelifeindiana.org. There's a contact us link, but also you're more than welcome to type out questions and send those to us and we will respond to them. And then lastly, you saw the Will Worthington story of hope today. We would love for you to watch other stories of hope. You can go to our Donate Life Indiana YouTube channel or our Indiana Donor Network YouTube channel. Thank you so much for your time.